I've started.
It's fine.
Yeah, we'll get into it. Good evening, all. Welcome to another edition. Obviously, I'm joined by the crazy one, Ashly. How are you?
Fantastic. How are you?
I'm plodding on. You have to, don't you? You have
Yes.
to. I'll be all right. Welcome, everyone, as well. And we have the sleep medicine specialist. Have I got that right?
That's correct.
Yeah, Barry Krakow. If I said that wrong, I have.
You can go with Krakow or Krakow. Those are the two most common.
Okay, we'll go for that. So, for everyone, please do share this, subscribe if you haven't already. And Barry, let's kickstart with tell us a little bit about yourself.
So I've been in the field of sleep medicine more than 30 years. I'm an internist by training, but fell into the field of sleep medicine basically through divine providence, in my opinion. And in that process, I've been working with mental health patients with sleep disorders my entire career. So I've learned so much more about sleep and mental health than most sleep doctors, and done research. So we've published lots on this topic. I've written several books, and we've really come to some remarkable conclusions. The first of which I'll mention is that most people don't understand that sleep and mental health is a disorder. They think it's a symptom, a condition, a complaint, something you treat with medications, something that you treat the primary PTSD, and somehow the sleep will get better. And what we've learned is that that's actually incorrect. The sleep is functioning as its own sleep disorder, and you have to learn to identify it, diagnose it, treat it distinctively with treatments that are quite different than what the mental health community is using. Excuse me if I'm hearing this, but I keep hearing a dog.
Ashly.
Yeah. She's in her cage, and I can't get her to be quiet.
Okay. We'll have to do something to get her to go to sleep.
Yeah, I wish. I'll put her outside. Hold on.
Sorry about that.
No
Told you she's the
problem.
crazy one. Please proceed.
So working on a sleep disorder is very different than working on a sleep complaint. You know, a patient walks into a doctor's office and says, I got some trouble sleeping. That doctor often will reach for the prescription pad and say, well, you know, trouble falling asleep, trouble staying asleep, you know, what exactly is the problem? And then it's very common to write a prescription or to make a mention about, we'll go get some over-the-counter sleep aids. And most of those situations should be treated differently, is what I'm driving at. And in the mental health professions, this knowledge is not widely disseminated. It's very poorly disseminated. We're talking about less than 10% of most mental health professionals, psychiatrists, psychologists, therapists, know what I'm talking about. And I know that because I'm contacted virtually every day by somebody asking a question about this exact topic. Like, why doesn't my doctor understand something about my sleep? Why do I think that medication is the only answer?
Okay. Yeah. So, for those that don't know, what's the difference between sleep deprived and insomnia? Because people are forever using insomnia, and it's not always insomnia, is it?
It's a great question because the concept of sleep deprivation is its own problem in society where people have so much disrespect for sleep and believe that they don't need it, they can get by. And by the way, there are some people that can do that. They tend to be younger, they tend to be more physically and mentally fit, and those individuals are very fortunate. They can get by on less sleep. But for the rest of us trying to deprive ourselves of sleep and then, drinking so much Red Bull or whatever caffeine products they can find to compensate will last for a period of time. But eventually it does produce the problem of sleep deprivation. Insomnia is a much more complex problem because you're not doing anything voluntarily. You want to sleep, but you can't. Or you wake up from sleep and you can't get back to sleep. So insomnia, most people do use the term accurately because they're the ones complaining about their sleep. A sleep deprivation person is saying, oh man, I just need to get some more sleep. And they know how to figure out their problem if they want to figure it out, but some of them feel like they can't. They literally think that caffeine is the solution. But insomnia is an actual sleep disorder. Very, very common. It affects chronically 1 out of 10 adults and probably 1 out of 3 people experience insomnia in the course of any year. Is he going to take a nap?
I don't know where he went. That's so. How would you take like new parents, for example, and that sleep deprivation? Is there a way to quote unquote ever catch up when it comes to sleep?
The general category of catch up, we also use the term sleep debt, is very real and absolutely amongst, let's say, adults first who are not parents, but they're adults having sleep problems. Once their sleep disorders are treated successfully, then there are periods of time that might last 3 months, 6 months, even 2 years, where they're noticing they're getting more sleep. And they are, figuratively and even somewhat literally catching up on what happened before. In the situation you're describing regarding parents, it's very, very different because the issue there is that why does the infant or toddler have problems with their sleep? And if the infant and the toddler have their sleep problems, what are the parents doing that is not facilitating the child from sleeping all through the night? Most people don't recognize that the average infant and toddler should be sleeping through the night no later than 2 to 3 months from birth, notwithstanding, medical or other conditions, prematurity, and so on. But children can learn very, very quickly to sleep through the night. And there's many parents who describe that in their kids, but unfortunately, there are a lot of parents that don't have enough knowledge on this topic or experience or something where they think that it's this complex issue that requires all of this input from the parents. And sometimes that's true, but most of the time, the more input the parents have, the worse the problem is going to get. And that's having to do with managing small children, because it's scary when you first have a child, your first child, you want to know what they're doing all the time.
Yeah, absolutely. Sorry about that. My son's just kicking off, as he is 1 year old. You know how it is.
That's what we were talking about.
Exactly. Because obviously, speaking of that, that's linked to this. Because obviously, when he was teething, which obviously he's still teething a little bit now, he struggles, and he does wake up. Like at the very start, when he was first born, he was waking up every 2 hours. Every 2 hours. But now, last night, he slept for a good solid 9 hours, and then he woke up and he was up for about half an hour, and he fell back asleep again.
Right. Yeah, they
So
learn. They learn over time, but there are things like temperature issues, comfort issues, hunger, all these things, but they can learn. And usually by 1 to 2 years, almost all of them become good sleepers, unless something else is wrong. And that brings us back to something very interesting about mental health. If you do an interview with a mental health patient, somebody who's in their 20s, 30s, 40s, 50s, 60s, whatever, and they've been through trauma, and they have PTSD, and they have sleep problems, you will be surprised how many of those individuals will tell you that historically they don't remember being a good sleeper. They had sleep problems when they were teenagers. They had sleep problems when they were children. Some people even know that their parents told them, well, you had trouble settling when you were an infant. And so that's what's so remarkable about this, that we do think there is a sizable proportion of PTSD patients who have sleep disorders that really are an aggravation of a condition they already had at some milder level. But now, because of the trauma influence, it just makes everything worse. Insomnia, nightmares, sleep apnea, and so on.
Did you experience any of this?
I have had in my life multiple sleep disorders for which I have used all of the most advanced treatments out there that I've either researched myself, researched on other patients, published studies on, written books about. I had very mild insomnia when I was a teenager. I had more moderate insomnia in my 20s. When I went to medical school, no insomnia. Sleep deprivation completely eliminates insomnia.
Yeah.
And so after medical school and residency, getting married and having small children, my insomnia came back. And around my late 40s, I was diagnosed with sleep disordered breathing. And I've been treating that with some very advanced treatments. And now in my 70s, I'm treating a condition called restless legs and leg jerks. So that's the three big ones: insomnia, sleep apnea, and leg movement disorders that I've dealt with pretty much, at various stages, all my life. I've never had the problem of nightmares, although I got into the field of sleep medicine by studying people with chronic nightmares. That was back in 1988. And when we did study nightmare treatment with these patients, I was very happy that during that period I developed some nightmares because it helped me understand them a lot better.
Mm-hmm. Ashly?
So let me throw something in. Something in. So where the rubber meets the road in all of this is that people have many preconceptions about sleep. Like some people look at sleep and they put it in the category, well, it's sleep. That's a waste of time. Other people put it in the category of, well, I need my sleep, but it's kind of annoying, but whatever, I'll do it. But then there's a whole category of people, and this overlaps with the mental health community, mental health professionals, the mental health patients, where sleep is very noticeable to them. It's very noticeable that something is going wrong. But here is where, as we say, the rubber meets the road. Most of these individuals have gone down the path of believing It's the number of hours you sleep. And this is exacerbated by the media, magazine articles, other books, even other sleep researchers, constantly talking about, oh, you need 8 hours of sleep. And then they change it and they go, oh, well, that's now 7 hours of sleep. And then they change it again. Now it's 7 to 9 hours, as if the number of hours is the solution to everything. Now, that number of hours question is very interesting to the people over here that I first mentioned that kind of look at sleep like, well, I don't like it or I disrespect it, whatever. But those people should know something about the number of hours of sleep because there may be something not so terribly abnormal about their sleep. But over here in the mental health community, you are barking up the wrong tree. It's not the number of hours. It's actually what is going on in your brain when you're sleeping. And what that means is something very specific. And we call it sleep quality. So if you're not talking about sleep quality, meaning how do you feel when you wake up? What was your sleep like during the night? If you're not talking about that to a mental health patient, then you can't fix their sleep problems. Literally, you can't fix their sleep problems because 90% or more of mental health patients have a sleep quality problem, not a sleep quantity problem, even though their doctors, their therapists, and the patients themselves want to keep talking about hours of sleep. Does that make sense?
Yeah. Yeah. Hi, Mac. I hope you're well. Yeah, absolutely.
And so that's the big.
I've just done a quick Google search, and obviously I know that Google is portrayed by the media, and it's saying that adults, like especially my age, should get between 7 and 9 hours sleep.
Right. That's what's called conventional wisdom.
Yes.
It has a semblance of truth to it, a semblance of truth, but it's actually dead wrong. You know why I say dead wrong? Because it is actually going to make people think that's what their solution is. And they're going to end up dying, literally dying, because they have underlying sleep disorders that they don't think are important because they don't even know about them. Their doctors don't know about them. The average patient that we see from the mental health community, or I've been doing this now for, let's say, clinically, as well as the research, but clinically since 1995. So we're talking about, I'm coming to the end of 30 years now of seeing mental health patients walk in the door to a sleep clinic. These people that I'm seeing are going 10, 20, 30, 40 years, and in some cases 50 and 60 years, being told their condition is psychological. Here's this pill. Here's your treatment. That's it. And what do we find? They have a physiological problem, and forget about the sleep for a moment. You know what this physiological problem is doing? It's damaging their brain. It's damaging their heart. It's damaging their lungs. And it's killing them. And it's actually leading to things like dementia, heart attacks, all kinds of stuff because physiological sleep disorders cause all this damage to your brain and your cardiovascular system. So you would think by now that many people would get this, but they don't. And they can't crawl out of the box they're in and realize that they're self-indoctrinating themselves to believe that it's all about the hours of sleep. And I'm very, very assertive and aggressive on this because we've seen it for 30 years and we see it over and over again. Like I said, I have to even deal with a client every week in my sleep coaching service who's going through this process and not even getting the care they need because their doctors won't listen to them, as well as their therapists, psychiatrists, and psychologists. So it's very frustrating for these individuals who are even now getting to the place they need to be. But so many people out there don't know this information that we're talking about right now.
So like for example, we've just got a comment off Rebecca. Hope you well, by the way, saying that I would love 4 hours of sleep. Is that linked to underlying trauma, or is it linked to anxiety?
I could not hear the first part of what you said. Am I supposed to read the chat?
No. Right.
Oh,
I'll
okay.
pull it up. Like, for example, Rebecca's just put, and I'll hope you're well, Rebecca, as well. I would love 4 hours of sleep. Now,
But what does that
we would
mean? She's
love
only
as
getting.
much sleep as we can.
Well, no, but is
is
she only getting 3? Is that what she's trying to tell us?
how much she's getting, Rebecca? But what I'm asking is,
okay, go ahead.
Is that linked to trauma or anxiety?
You mean why somebody is sleeping like less hours?
Yeah.
Is that the question? Right.
Yeah.
So this is a great question. This is, again, coming back to something, because you say, well, wait, if somebody's supposed to get 7 hours and they want to get 7,
Yeah.
but now they say they're getting 4, you go, well, I mean, well, what happened? Did they lie in bed trying to fall asleep? That's one possibility. But the biggest complaint in the entire world, Western civilization, is that people cannot sleep through the night. So yes, there's some people, particularly younger people, who say they have trouble falling asleep. But 90% of the biggest sleep complaints are, I went to sleep, I was asleep for a couple hours, I was asleep for 3 hours, 4 hours, whatever. I wake up, I can't get back to sleep, I'm toast, that's it, and I got to get up. What do I do now? Those individuals, I'm going to walk you through this because this is such an amazing thing. And we did research on this and we published it over a decade ago. These individuals are wide awake when they get up in the middle of the night. Now think about that for a minute. That's crazy. You know what it's like to be in bed and you roll over from an awakening and you go, well, I'm really sleepy. I'm going to roll over and go back to sleep. Virtually everybody in the world has had that experience. You wake up, you're sleepy, you go, I'm going to go back to sleep. But these individuals who wake up wide awake, they can't go back to sleep. So you got to ask the question, why did they wake up? And now you're going to ask, Adam, did they wake up from their trauma experiences? Did they wake up from a nightmare? Did they wake up from anxiety? Well, all of those are possible. But we did research showing they wake up for a different reason. So I'm going to give you a little quiz here and see if you can figure this out. What would make somebody wake up and be wide awake? I mean, there's got to be a reason. Do you know, we did this study and we asked these individuals in this particular project, why do you wake up? All of them said, I have no idea. And most people will tell you, I'm asleep at the time, so how would I know, right? So they go and say, could be this, could be that, could be nightmares, could be the temperature, could be a trip to the bathroom, could be anxiety, could be trauma. They say all of that. We put them in a sleep lab and we monitored them for their awakenings. And they had excessive numbers of awakenings. And you know what preceded every single awakening, or nearly every one, 90%? Can you guess?
Go on.
A breathing event. They were struggling to breathe.
That's how long she's getting.
Yeah, so maybe she's going to listen to this concept. This is what these individuals go through. They sleep for about 3 hours. 3 hours tends to be your deepest sleep. In your deepest sleep, your airway is well protected. Once you get out of that deepest sleep for the second half of the night, the more fragile stages of sleep continue on, stage 1, stage 2, and REM. And so people are more susceptible to having breathing events. And when that happens, let me tell you what a breathing event is. So let me show you. Take your hands right now, take both your hands and put them around your neck. Grab your neck. I'm serious. Adam, Ashly. Now I just want you to choke yourself a little bit, okay?
Does it have to be a little bit?
So when you have a really bad apnea, no air is getting through. None. Zero. But if you just choke yourself 25%, and it sounds crazy, like who would want 25% choking, right? Well, 25% of loss of air will wake you up. And guess what your brain and your heart does when you wake up? Your heart rate goes up, your blood pressure goes up, your breathing rate goes up because you're trying to correct your breathing. You may start sweating. So you're now wide awake. Why? Because you were just choking. You were under threat. And think about this. This is a really cool question. What is the most primal fear anybody can have? There's only one answer to this question. What's the most primal fear that nothing can top in terms of the intensity of the fear that you will experience? It's the experience.
I would say, this is just my guess, is waking up and there's a face right in front of you.
That's sort of close, but not quite. Ashley, you want to guess?
Death.
Exactly. And when you have the inability to breathe, then you believe you're about to die. So people who have apneas in a certain strange way are luckier because they've had the experience of waking up at night, choking, not being able to breathe, and they go, holy cow, there is something wrong with me. I better go see a doctor. So they have that experience. But there's many other forms of sleep disordered breathing that are not as dramatic. And that's what we learned in our research. And yet, even a 25% decrease in your breathing is threatening to your airway. And therefore, your brain says, I'm under attack. I have to respond. I better wake the heck up and breathe. And so when you do that, you bring all your sympathetic nervous system into play, and now you're wide awake. And now that person can't get back to sleep for 1, 2, 3, 5 hours unless they learn certain techniques, which they can read about in this brand new book, Life-Saving Sleep.
So I have to ask before Ashley jumps in and tries blaming men for keeping her awake at night. I'm joking. I think we're all guilty of this. The blue light syndrome. That keeps us awake.
So I'm a big myth buster. And what I'm going to say here, some of your audience, I'm sure, will disagree with because they've had what's called anecdotal evidence about their experiences that have worked out in a certain way that supports what you're referring to. So unequivocally, if people feel overexposed to bright light in the evening and they notice that it's waking them up, we had a recent experience here in Savannah with hurricanes and there was no power. So we're back in the Stone Age and everybody is obviously going to bed earlier because there's no more lighting. So that is interesting confirmation of that idea. My point, though, is that when you deal with people who are dealing in the realm of what are called sleep hygiene techniques, and this is one of them, it's like, is the temperature in my room important? Absolutely. Is the lighting in my room important? Yes. Is the mattress? Is the noise? All of these things I unequivocally support anyone's efforts to modify these, because if you notice that it makes your sleep better, do it. I have to use a type of machine. It's called positive airway pressure. You all probably know it as CPAP, but we stopped using CPAP years ago because we don't think it's a very effective machine. Nonetheless, there's other kinds of CPAPs, and that's what we use, but they still make noise. So I wear earplugs with that machine, and that is something, that is helpful. But what I'm going to say is, the more you find yourself looking for this factor and that factor, and I got to do this and I got to do that, that suggests that you have some problems with what's called light sleep. And many of these individuals will use that phrase. They'll go, well, I'm a light sleeper. And I ask them the question, how long have you been a light sleeper? Now, most people will say, I'm not sure but I think it started, like in women, it'll say, I think it started around the time when I had my first kid. Other people will say, I think it started when I went to college. Those are common answers. You do get some answers that are, I've always been a light sleeper. Ever since childhood, I was a light sleeper. Here's the news, the great news. Light sleeping means there's something physiologically wrong with your sleep that can be corrected by getting a sleep study, analyzing the data, and actually finding out, why is your sleep so light? So if the person says, I'm a light sleeper, so I'm going to put in earplugs, I'm going to put in nightshades, I'm going to make sure I've got a white noise machine, they can do all that. And I'm happy for them because those things can help. But they should also be asking the question, why am I a light sleeper? And the answer often proves to be physiological. That can be actually tested in a sleep lab.
Ashly, before I move on, anything to say?
So, do you find that there are other ways to treating sleep apnea other than, like you had said, as far as the CPAP machine that's kind of gone away, but are there other ways to treat it?
I'm so glad you asked the question, because in my book, I have a section that's all about this idea, in the sense that for your viewers listening or watching, they'll hear this information and it's really hard to digest because they're hearing it from one person. They didn't walk into the primary care doctor's office and said, oh, by the way, I just read this thing and I think you have sleep apnea. They didn't even hear it from a psychiatrist. They didn't necessarily hear it from a friend or family member. So what we've developed now is a technique or a methodology called early conservative treatment of sleep disordered breathing. And the whole idea behind this is somebody listening to me in this conversation, and let's make sure we get into this a little bit later or sooner than later, I can show you how you can evaluate yourself and know whether or not there's something physically wrong with your sleep. And so when you do that, in fact, let's actually do that right now. And then we'll come back to the question about how to treat it. So most people don't know what normal sleep is. There's only about 1 out of 4, 1 out of 3 people that are truly normal sleepers. So a normal sleeper, and I'll just run through this quickly, it'll be astonishing to most people. You get into bed, if you're a normal sleeper, you'll never guess what they do. They go to sleep. They're asleep all night. They do not wake up. This is a big one. They do not wake up at night to use the bathroom to pee, ever. They wake up in the morning feeling great. They don't wake up with a dry mouth. They don't wake up with a headache. They don't feel like they're forced to get out of bed. They're delighted to get out of bed. They've had a wonderful night. They've been dreaming parts of the night. They even remember some of their dreams. They like to tell some of their dream content to their spouse, their girlfriend, their boyfriend. They find that a very interesting part of their life. They get up, they get in the shower, and they start singing. And sometimes they come up with these incredible creative impulses of how they're going to seize the day. And they'll have all these ideas of what they're going to do that day. And then they proceed to go about their business all day long. They don't drink coffee in the morning. They don't drink tea in the morning. They go about their day. They may have a dip in the afternoon. During that dip, they could take a 5-minute nap. They could also just as easily pick up the phone, call somebody, and that dip just goes away. Some of them might have a caffeine, but it would be low dose. These individuals have a very interesting marker about them. Their evening hours are very different than most people. Their evening hours are not spent sitting in front of a screen. These people have hobbies, they have civic duties, they have volunteer work, they have all this stuff they do after dinner. They're very, very active. I'm not saying they can't be active like sitting reading a book, but it's very unusual to find these people watching much television or watching lots of movies. I'm not saying they don't ever do this, I'm just saying their energy level is so high that the notion of sitting and watching TV or a movie is like, well, what do you do while you're watching? do you stand on a treadmill or something? Or do you do your exercises? And then, of course, these people get into bed and go back to sleep and then repeat this thing ad nauseum all the time. That's a normal sleeper. Most people can't stand to hear this because they think that's impossible. That's got to be somebody who's super sleeping. But no, there are people out there that sleep normally like that. The rest of us usually have something physiologically going on in our sleep, and the number one candidate is a breathing change that develops often after puberty in many people. In some people, it develops after weight gain. Here's a very interesting one. Research seemed to suggest that it develops after trauma. The trauma may actually do something to the way you breathe. So people still hear all this and they still want to think that sleep is psychological. So the book, what I did is put in this whole section twice in the book, in the appendix and in the main book, called Early Conservative Treatment Steps. So here's how you do it. It turns out that if you have a breathing problem, or you wonder if you have a breathing problem based on what we just discussed, and let me come back to a trip to the bathroom, because that's actually a real, that's the way to close the sale, as we would say in sleep medicine. So I'll explain that one in a bit. But if you think you might have one of these breathing conditions, the first thing to look at is nasal breathing. If there's anything at all that you can pinpoint about your nasal breathing, then you can actually start sleeping better just by making your nasal breathing better.
Yeah, absolutely. Now, obviously, we've got a few comments already. Robert Brooker from Canada, he's brilliant. Obviously, he put when you said you was a myth buster, he put, I often enjoyed that show. Not sure super thick mustache would suit you though, Barry.
I don't know the show, so.
Oh, fair enough.
Sorry.
Gemma, welcome, Gemma. Hope you're well. And I'm going to pick up on the topic for you, Gemma, in a minute. She put, I find I sleep better in a cooler room.
Fantastic. Fantastic. Do you know what that means?
Go on.
So they did research on this decades ago, and they found that temperatures below 60 degrees Fahrenheit, don't know the conversion for you, but below 60 degrees Fahrenheit, very cold, people absolutely sleep better. But you know what the corollary to the research was? That when the temperature is colder, it encourages you to breathe better. So anybody who is obviously noticing that colder, cooler temperatures make them sleep better, that's actually part of conservative treatment steps. Lower the temperature of your bedroom, you may start to breathe better and you will start to sleep better.
Yeah. Well, speaking of breathing, I need to mention it. Sleep, mental health, alcohol.
So alcohol is very interesting because alcohol, when you first drink it close to bedtime, not necessarily overdosing on it, God forbid, but, you know, having a few drinks in the evening hours, maybe even having a drink or two near to bedtime, you can learn a certain dosage that will give you deeper sleep. Alcohol actually does deepen sleep initially. The problem is, aside from the fact that for some people that can lead to alcoholism, but the larger long-term problem in relationship to sleep directly is that as the alcohol wears off, your sleep may, this is an older theory, I don't know that it's been disproven, but your body may now sort of crave the alcohol. Yeah. And in that craving, your sleep gets lighter. So it's very common, at least among people who are regular alcohol users. to eventually
Yeah.
develop the problem. They wake up in the middle of the night, and when they try to go back to sleep, the sleep is very light and fragmented. The other part about alcohol is that it does damage your oral airway, the tissues inside. It can inflame them. So the more you drink, you do actually increase risk for sleep breathing problems.
Yeah. Yeah. All right then, Ashley. I just got your message. You go and sort what you need to sort out. Message me after. Yeah. Right. Obviously, Gemma's put. So then you're in a cycle. You need the alcohol to sleep.
That's right.
See,
And that's how some people, 1 out of 3 alcoholics, appear to have gone through the progression of becoming an alcoholic
like
by
me.
first using the alcohol to treat one of 2 problems: insomnia or nightmares. And so they use the alcohol to put them into a deeper sleep, hoping to suppress nightmares, helping to suppress insomnia. And it did work for them up to a point, but then that led to more drinking.
Because what I did is, because obviously I'm a recovering alcoholic, and I used to drink to cover up the trauma that I experienced. And when I was drinking just before bedtime, yes, it put me into a deep, deep sleep where nobody would wake me. They tried, they failed. But I was waking up on a regular basis to go to the toilet. Regular.
So let's do that one right now.
Let's do that one.
So what do you think are the leading causes of why a person wakes up at night to pee?
Dehydration.
Dehydration, meaning like so dehydration would be the opposite. If you're dehydrated, you wouldn't get up. But I thought you were going to go with overhydration, like they're taking too much water in close to bedtime. Does that make sense?
Yeah.
Okay. Anything else come to mind? Obviously, medications.
Medications, yeah. Anxiety.
Maybe anxiety a little bit. If, maybe anxiety wakes you up and you just say, well, maybe I'll just go to the bathroom. I'm awake. Some people take medication. Some people also have bladder problems or prostate problems.
Yeah.
But one day I predict that they will discover that the leading cause of trips to the bathroom is sleep apnea.
Okay.
And if you want to see a mini video on it, it's on my website, barrykrakowmd.com. And there is a video on there called Nocturia Cures, or Why We Wake Up at Night to Pee. And it turns out that sleep apnea causes your body to fight so much trying to breathe during the night. It alters your cardiovascular system, and the right atrium of your heart releases its own diuretic in response to all this struggle. So inside your own body, a diuretic is released. It goes to the kidneys. You're making more water during the night from your kidneys, and naturally you're going to wake up and pee. And so the very interesting treatment aspect of the problem is that if you give somebody a CPAP machine, and maybe it's not even the right pressures, maybe you just started them out on some low pressure because you're afraid they won't get used to it. So you go, well, let me start you on low CPAP so you can get used to it. This is one of the first things that goes away with CPAP. I've seen literally thousands of cases of people who are on like low pressures or medium pressures, and within a couple of days of using treatment, they no longer wake up at night to pee. It's gone. And they're going, how did that happen? Now, what's interesting about that from the point of view of long-term care, the other symptoms of sleep apnea take more time to treat. So the individual has to be on the device longer and has to learn to adapt to higher pressures. But what we found with trauma patients in particular is they could not adapt to high CPAP. So we switched them over to these newer devices called bilevel. And bilevel is a very important term to remember because most sleep doctors won't use this. And yet we, have written about it in the book, we've written about it in research papers, that with bilevel, you get a high pressure breathing in, but a low pressure when you breathe out. And that makes it much more comfortable than CPAP. And we found we can get, we published a paper not that long ago showing the highest rate in the scientific literature of PTSD patients using a PAP machine because we'd switched them all from CPAP to a bilevel device.
Yeah. See, we just had like Rebecca saying she sleeps with the fan on all year round. All year.
Right. And so that brings up two things, Rebecca. I don't know if Rebecca wants a coaching session or not, but I have that at my barrykrakowmd.com site. When a person talks about these kinds of behavioral factors, one is the fan makes noise. So that's showing that there's a sensitivity. They want some noise reduction or blockage, however you call it. And the other is that feeling of fresh air. Again, what is fresh air about? Well, it's about breathing. And so when people use these particular techniques, and they're all good, I'm not saying anything bad about them. I'm saying look deeper, dive deeper, and ask, well, why is it that you need the fan? Is it the fan is giving you perfect sleep? If Rebecca's only sleeping 3 hours, it doesn't sound like it, right? It sounds like there's still something else going on. And it would be wonderful if, like, she could wake up after 3 hours, turn the fan to a higher speed, and go right back to sleep. But most people don't find that works.
No, I'm one of these that there has been times, like even with my eldest as well. Once he is awake, that's it. He's awake. There's no going back to sleep. But he'll only go back to sleep if he's not well. Yeah.
So whenever anybody wakes up in the middle of the night and says they feel pretty much wide awake, I'll go back to what I said earlier. They have to ask themselves, how in the heck did I go from being sleepy to being wide awake? Just think about the comparison. Think of all the times in your life you woke up, you rolled over, you yawned, and you went back to sleep. Very natural. Almost everybody in the world has done that. Almost everybody in the world has done that 1,000 times. But once you start developing these sleep problems, you do that less and less. And then eventually you start having these really bad awakenings where you're wide awake. And you go, what is this all about? And the answer is it's likely physical. It's likely physiological. Now, getting back to the conservative treatment of this, let me explain that working on the nose has tremendous impact. We've had people take some of the steps I'm going to describe here in a moment who come back to us a week or 2 weeks later and go, I'm already sleeping better. So step number one is everything to do with nasal breathing, such as, do you have congestion? Do you have runny nose? Do you have a stuffy nose? Do you have allergies? And on my website, barrykrakowmd.com, there's a free 1-hour video series that's all about nasal breathing. And it explains a lot of the detail about what kinds of nasal sprays or other treatments that are good for solving nasal breathing issues. Then the next phase are nasal strips, things that go over your nose. Another step is putting dilators up inside your nose. If you do these things and you notice that your nasal breathing feels better while you're awake, you have an outstanding chance that that same technique is going to make you breathe better while you're asleep. And so we've had people come back and tell us things like less trips to the bathroom, feeling more refreshed, feeling more awake, fewer awakenings. And I'm not saying everybody gets all of those things. I'm saying this is sometimes subtle, but usually after 2 to 4 weeks, sometimes it's after 2 to 3 days a person will come back and say, no, this is different. And you know what's so cool about this is now the individual is buying into it. They're going, well, maybe there really is a sleep breathing problem here. And I've spent very little on these treatments, hopefully, and they seem to be working. And by the way, I've had people run with this stuff for a year. They'll do this stuff for a year and go, I can't believe how much better I am feeling. And then a year later, they come back and say, you know, I don't know if I've reached my limit or not, but I'm so curious now. Do I need PAP? Do I need one of those dental devices? Do I need surgery? I want to explore more because I realize this is a really big deal.
Yeah, absolutely. And obviously Rebecca's put, which obviously we've covered already, about how she takes lots of medication and her doctor says she should be sleeping like a log, but she doesn't.
All about this book, Life-Saving Sleep, and my other book called Sound Sleep, Sound Mind, that was written 15 years ago. This is exactly what I specialize in. People who are on multiple psychotropic medications, sedative medications, over-the-counter, prescription, sometimes illicit drugs, because that's what they're doing to sleep. And they've not gotten the intellectual education and support to really dive into why these medications are not working. That's what I do in the book. That's what I do in my coaching services. And we have helped so many people turn the corner on this. Right now, I've been working at a psychiatry residency training program here in Savannah, and I'm teaching the psychiatrists how to reevaluate the sleep of their patients so that they can learn non-drug treatments so the individual can get an actual better, deeper sleep, and in some cases, getting them off those medications.
Yeah, absolutely. Yeah, because she's overthinking and her brain's going like 110 miles per hour. But what I'd
Right.
like to know is, from your sleep problems, what
Mhm.
strategy did you implement for you to start helping others?
Right. The two big ones for me were what's called emotion-focused therapy, which is a kind of psychotherapy that delves deeper into your emotional state. So, for example, if you suffer from anxiety, instead of asking the question of what is the way to treat anxiety, the question really is, what is anxiety?
Right.
And anxiety in most people, not everybody, but anxiety in most people, the majority of people, is not a condition that I believe gets over-diagnosed, called generalized anxiety disorder. Many such individuals have learned not to dive deeper into their emotional state to gain the emotional wisdom trying to be offered to you, because the purpose of the emotions are to serve and protect you. You have emotions to help you know yourself better, to help you learn about what's going on in your environment, what's going on in your mind, what's going on, obviously, in your heart. Another way to say this in abbreviated fashion is simply listening to your heart. So anxiety is considered a gatekeeper emotion. It prevents you from diving deeper in. And many trauma patients, for example, know that they have to dive deeper to get someplace. So once I did that, I found that had a lot to do with decreasing some of the racing thoughts. But the second aspect, which was the biggest, really, although I should say both of them are equally big, was that once I started my sleep breathing treatment, it also led to a reduction in racing thoughts, and it clearly led to the reduction in the awakenings. Because if the awakenings are caused by a breathing problem, then by treating the breathing problem, you make the awakenings go away. Those are the two biggest therapeutic interventions I've used now since 1993. So that's more than 30 years. And I've been very, very pleased with the results.
Brilliant. Brilliant. So
by the way, the emotion focused therapy part is also in the book Life Saving Sleep, and in my earlier book Sound Sleep, Sound Mind.
yeah, I was just about to say, where can people find you?
I'm in Savannah, Georgia, and I'm on the Eastern time zone. I guess we're changing our time tomorrow night. You changed yours recently.
Last week, yeah.
My website is barrycrakowmd.com. There's lots of free videos and information on the site. There's also some books and videos for sale on the site. I have a free Substack newsletter called fastasleep.substack.com. And generally, I will either be posting there items about recent research, things that come up, and giving a short comment. I'll be posting, for example, this podcast, when it gets published and so forth.
Yeah.
And so different things like that go up anywhere from like 2 to 5 times a month. And again, completely free. And I mentioned that on the main website, barrycrakowmd.com, I do tend to see two kinds of patients. One are the chronic insomnia patients who've been given a long period of, lots of medications. That's the answer, and it's not really working. And they want help. They want to know how to, treat insomnia with either less medications or stay on their medications, but still treat their insomnia. And then the other very common patient that I see is those struggling to learn how to use a CPAP device, when I help them understand that a bi-level device would be much better. And I coach them so they can learn how to talk to their doctors to get a bi-level device.
Yeah. Well, Rebecca's heading to your website probably straight after this. So yeah, I think that's it.
Now, Adam, I've got a question for you.
Okay.
Have you heard enough to consider the possibility of getting a sleep study?
Yeah.
Good.
Yes, as everyone else, everyone in the comments.
Well, it's a big step. It's not a natural, organic step for people. Like they say, oh, go get a sleep study. I mean, one intermediate step some people try are these wearables. And I strongly encourage people to get these wearables, not because they give accurate diagnoses or perfect data, but they often do qualitative things that are very interesting. I'll give you one short example.
Yeah.
I met a guy who was telling me about, I'm looking at my my wearable. I'm looking at my Fitbit, whatever the thing was he had on his wrist. And it said, my sleep is really light. What's wrong with me? And I got him to put on a nasal strip. And 2 days later, I talked to him again. He goes, you're not going to believe this. My wearable said that my sleep is completely different now. And you know what? I feel better. I wore the nasal strip for 2 nights. That was it. So that's, again, another way to sell it to yourself, because you go, that's a really big step to do a sleep study. But if I can do something that makes me go, gee, maybe this does apply to me, that's very empowering, because you've done your own trial and error. You have what we call in medicine self-efficacy. And you've come out the other end and said, you know what? I'm feeling better. There must be something to this. I'm going to put my time and energy and attention into this, because I'm probably going to start to sleep better. And one last episode, when I started doing all this and I got my sleep breathing treated, my life was so different that in a 3-year span, I wrote 2 books, one on insomnia, one on treatment of nightmares. I left the university environment. I opened up my own sleep research facility. I opened up my own private sleep center, all within just a couple of years. Why? Because I had more energy than I could ever have remembered, even dating back to my adolescence. just by having treated my sleep disordered breathing, which initially, during that period I'm describing, I just treated with a dental device that goes in your mouth and holds your jaw forward so you get more air going through. I hadn't even been on the PAP machine yet. So that's how much it can change a person's life.
Yeah. Yeah, well, I want to thank you for coming on. It's brilliant. Next week, who've we got? Same time next week, we have got Kevin Crispin, and we're talking about different trends within the mental health space. So that could be a trigger to someone. So I'm going to leave it there. Thank you for coming on, Barry. Sorry about Ashley, everyone. Family commitments. But she'll be back next week, I hope. So, yeah. Thanks.
Appreciate the time.
You too.